to show you how I find a vein, like if I was drawing a patient. Okay, hi guys, fellow phlebotomist Bree here. I always get asked the question, what do you do when you can't find a vein and you have that hard stick? What are some tips? What are the things you do to help find that vein? So I'm going to give you guys a few tips of what helps me and what has helped me in the past. So let's go over it. So first things first, key tip, always ask the patient if they're hydrated. Make sure they've had water before their blood draw, unless it's a test that requires no water at all, because sometimes there are tests like the H. pylori breath test that you cannot have water. But water is key. Always make sure the patient is hydrated, because if those veins aren't hydrated, they're going to be very constricted, very small. Blood flow is going to be very slow. Naturally, some people have smaller veins, so their veins aren't going to be as prominent as others. Some have deeper veins. So it just all depends on the patient. When I was going to phlebotomy school and I was learning, of course I was scared, I was nervous. Who isn't scared and nervous to find veins and poke veins, especially when you don't see them? Vision and seeing the vein is really just an added bonus to being a phlebotomist. You really don't need to be looking at vein, if that makes sense, because it's all about the touch. And I don't care what anybody says, yes, you can see a vein. You obviously want to look when you're actually drawing the blood. You want to be looking at the, where you're drawing. No matter where you're going to go on the arm, the hand, the forearm, the back of the arm, I've done many draws. You're going to want to feel for that vein. So I'm going to show you how I find a vein, like if I was drawing a patient, okay? So guys, like, don't come for me because I've never actually drawn blood on myself, but I want to show y'all. Don't judge me because I've never drawn on myself. So guys, obviously you guys see these veins, okay? I have a really good one right here, a good one right here, and a good one right here. So imagine just me looking on a patient's arm. You're gonna go for the touch, okay? If you feel a vein, it's gonna be bouncy. It's gonna bounce back at you. Obviously I have very good veins, but they're gonna be very bouncy and it's gonna feel thick, okay? Some obviously have a little bit thinner, but you're gonna know when you feel that bounce. I use 2 fingers. Don't look at my nails because I gotta get them done. They look terrible. I'm trying to grow them out. But it's all about that touch. You see it. You'll feel your finger bouncing back at you guys. It's literally like bouncy. You're gonna go find a vein by not looking at it. And when you feel it, mark that spot. Open your eyes and see where it's at. And you're gonna remember. You're gonna remember when you feel it and you're gonna see it. If it doesn't come out, don't trip out. Just relax and go with confidence. Confidence is key, guys, okay? I've always say that. Confidence is key. You don't want to go poke somebody and you're unsure. Don't ever poke somebody and you're unsure. Another key tip, I tell patients, sometimes if their veins aren't as prominent and they're very deep, and I'm not saying do this all the time, but there's an exception sometimes where you can have the tourniquet, tie it up. If it's too tight on a person's arm and it hurts, have them put like a jacket on, put something over the tourniquet so it doesn't hurt their skin, and because no one wants it to be, uncomfortable. But I tell patients to pump their arm at least 5 times. Not crazy, just a nice little pump, and the veins are going to come out even more. That key tip of not looking, a little pump, is going to help you out so much. You're going to be like, what the heck? Why didn't I do this before? Sorry, I had to take it off because it's a little tight. Another thing I do that helps me get a vein if it's not coming out or it's, it's a little bit smaller, you can lightly, I'm not saying hardly and roughly, you can flick the vein to get it to come out more. Because if you flick it, it's going to rise and it's going to come out. Unless it's like very deep. But most of the time, that'll do the trick. A little flick too. Never have the patient pump their hand during a blood draw because it will ruin the specimen quality of the blood draw. And you don't want to have to redraw a patient because they were pumping. That's only when you're actually donating blood and stuff like that. You're going to want to pump your hand. So if someone is holding that fist or they can't hold that fist really tight to get the vein to come out, I'll have the patient hold some tubes or something along the line of it and squeeze the tube so they can get that vein to come out more, because sometimes elderly people can't squeeze their fists as tight, you know, because they have conditions and stuff like that, or just some people just can't squeeze their hands that tight for other reasons. Yes, you can be a skilled phlebotomist and you can still miss because of how thin the vein is and how hydrated the patient is, because literally I've had draws where literally the blood will stop midway. Sometimes patients only have literally one good vein. Sometimes, it's not all the time, but you'll get those patients that like don't have any veins and they have that one vein they always use. So if they have that one vein they always use, always go for that one. Never tell them that you're gonna pick the vein unless they tell you. You pick whichever. And I don't want to hear about these vein finders, because these vein finders don't work. I've heard many stories. I've never actually used one, but I've heard terrible stories from patients and from other phlebotomists who've said they tried vein finders and they don't work. Don't be scared. Don't be nervous. Of course, every draw is not going to be perfect. Every stick you're going to get is not going to be perfect. You're going to miss. You're going to get those veins that are so hard you feel like giving up. But don't. Take your time. Don't rush. I enjoy being a phlebotomist because I love making those patients happy and making them feel more comfortable. Because nobody likes getting their blood drawn and getting stuck so many times. It's all about the comfortability for the patient. I don't care to use a straight needle. I know how to use a straight needle. I don't mind using a straight needle if the patient wants me to use a straight needle. But I'm going to go ahead and use a butterfly. And there's two types of butterflies. That's what I love about the butterfly needle. And I don't care if it's to some people slower than the regular straight needle. Guys, there's the 21 gauge, which is used for like blood cultures and stuff like that. But I use them for like regular, you know, when I have a big order, I'll use the 21 gauge needle if the vein's very good. Or you can go with the 23 gauge, which is a lot smaller, and it makes the patient feel so much better, guys. Like, I will use a butterfly on a patient if it's a hard stick. I really don't care, because you can maneuver it a little better without digging into somebody's vein and giving them a hematoma. Like, you don't want to be fishing in someone's arm. Like, that's the one thing I never do. Obviously, you have options for needles, and honestly, I don't mind using a straight needle, but I'd rather go with a butterfly for my patient. Like I said, I'm about the patient. I want to make sure my patient feels comfortable. And using a straight needle, I know how to use a straight needle. I'm very good at using a straight needle. It's just for patients. Some people don't like when a phlebotomist is like the hand is moving a little bit. I'm not saying like you're completely moving, but sometimes your hand is moving a little bit as you're switching out the tubes. You know, there's a little bit of movement. As phlebotomists, we are the middle person, the middleman, the middle woman, whatever you want to say. We are that middle person, and it's crucial for the patient to get blood drawn from doctors. So doctors rely on us to get blood drawn. Nurses rely on us to get blood drawn. But phlebotomists, this is what we learn. This is what we're skilled at. You know, this is what we do all day. We look at veins all day. We poke those veins all day. So as phlebotomists, we are really needed, guys. So don't give up if you feel like, you know, your skill at drawing blood and finding a vein isn't as well and it isn't as good. Because over time, you'll get better and better and better. The more experience, the more practice you get, the better you'll get.